Communication barriers limit access to healthcare for many within the deaf and hard of hearing communities. Poor communication can cause dangerous clinical consequences, compromise healthcare quality, and diminish doctor-patient trust. It impacts more than patients, too. Studies show many clinicians are less comfortable treating patients who are deaf or hard of hearing, likely because they lack the tools to do their job well. That's where we come in. We're here to help break down the barriers so no one gets lost in translation. Let's get started. Good communication looks different for different people. There is no single best accommodation that works for everyone. Don't assume you know what's right for a patient. Different people have different preferences, whether signing, lip reading, written notes, an interpreter, or something altogether different. To understand your patient's communication needs, ask, how can I best communicate with you? But good communication doesn't end there. You need to make sure the message gets through. Otherwise, critical information can get misinterpreted or lost altogether, diminishing trust and quality of care. To prevent miscommunications or confusion, periodically stop and check in throughout a conversation. Before you run diagnostics, take vitals, or do anything with physical touch, explain what to expect, confirm understanding, and get consent. And provide brief, easy-to-read, written follow-up instructions whenever possible. Many patients prefer to communicate via an interpreter, but not all interpreters are created equal. If a patient does not trust an interpreter, they may withhold information or avoid asking questions. Family members are not a substitute for an interpreter. It can be uncomfortable for everyone involved, compromise privacy, and risk important information being incorrectly translated or left out, or a family member inserting their own commentary. Instead, build a trusted network of local interpreters specifically trained for medical encounters that both you and your patient can rely on. Lots of little things can make a big difference, positive or negative. Looking away, talking too fast or too slow, covering your mouth, and having side conversations can all make a patient feel isolated. Instead, communicate with your patient, not about your patient. Maintain eye contact with them, not their interpreter. Communicate in a well-lit and quiet environment with few visual and auditory distractions. Speak in full view of your patient, especially if they are a lip reader. Introduce anyone who enters the room during an exam, and if you wear a mask, use a clear one. The most effective communication starts with a plan. Establish effective communication protocols and procedures, and train staff accordingly. Develop a collection of easy-to-read, written reference materials, instructions, pictures, and diagrams outlining different tests, procedures, and conditions. Everything from what to expect during surgery to what articles of clothing to remove before the clinician arrives. Let's recap with some key takeaways. Don't assume a patient's preferred communication. Ask. Don't leave patients in the dark. Explain things, and make sure the message gets through. Build relationships with professionals you and your patients can trust. Don't talk about your patient, talk to them. And if you wear a mask, use a clear one. And finally, prepare in advance to strengthen your communication in the moment. Want some extra credit? Learn how to sign "How are you?" It's a simple action that goes a long way. Good communication comes with its own set of consequences. Positive ones, like more effective treatment, fewer unnecessary tests, better outcomes, and best of all, happier, healthier patients. Plus, it's not an option. It's your professional, ethical, and legal obligation. And most importantly, it's the right thing to do.